Hello everyone, myself Dr.Shail Gupta. I am a professional dentist. I practice in my clinic. I am the owner in my clinic, that is Shraddha Dental Clinic. Today guys, let's discuss about ulcer. What is ulcer in the mouth? In Hindi it is called as chala. Today let's discuss about the ulcer, why it happens, what are the conditions, what is the treatment. This all we'll discuss in this topic. So ulcers are mainly because of varieties of reasons, like because first reason is like our stomach is not clean. What we eat remains stagnant in our stomach. Our stomach is not clean. Some patients have constipation, so basically it all collects in the stomach and not clean. The stomach is not clean and the ulcers are seen in the mouth. So that is one of the reason why ulcers happen. The second reason guys, like ulcer is because of maybe some sharp teeth. Some sharp teeth are there, the teeth which are शार्प, देन नुकीले दांत जो होते हैं उनसे भी अल्सर हो जाते हैं. कभी हम चबा गए अपने लिप्स का ये साइड वाला, ये अपने गाल वाला एरिया या लिप्स वाला एरिया, या फिर अपना टंग भी अगर चबा गए गलती से, तो वो एक वुंड की जैसा, घाव के जैसा बन जाता है, जिसको हम अल्सर कहते हैं. तो दिस इज़ वन ऑफ द सेकेंड रीज़न वाई अल्सर्स हैपन. एंड थर्ड रीज़न इज़ like if any person is eating some hard things, like some kind of candies like chocolates it comes, and suppose some food is there which is sparky type, spikes are there, and like it is also like sharp. So because of that it hurts, it causes trauma in the oral cavity, in the mouth overall. So any point which hurts, the food hurts the oral cavity, so that is also one of the condition of ulcer. And one more condition of ulcer is because some dentures, like some people wear dentures, okay. RPD is complete denture, or removable partial dentures. So the prosthesis, the dentures which are placed in the mouth are not compatible with the mouth. It is not properly fitted. So suppose we talk or we chew, so it not fixed properly, so it may hurt, it may cause trauma, and it may hurt, and it takes the form of wound, or that is also known as ulcer. I think all the things I have discussed. And yeah, these are the conditions why ulcers happen. Sometimes our stomach is like, the environment is so much hot type, like too much of hot fluids if we drink, or some, like some hard medicines we are taking, and the stomach environment is not favorable, and yeah, overall it takes the form of ulcers in the mouth. um, One more important uh, reason why ulcer happens. Sometimes while brushing the teeth, we hurt it. Suppose we are brushing the teeth, and suppose slightly we go in wrong direction, so that hurts the teeth, that hurts the skin, that is mucosa of the oral cavity, so that may also take the form of wound, and that is also known as ulcer. So yeah, that is all ulcers. Now we discussed what are the reasons or why ulcers happen in the mouth. Okay, now I'll discuss the things which we feel when ulcer happens. Then what are the conditions, how we feel. So if ulcer happens, it's very painful. We are not able to eat anything, it doesn't taste good to our tongue, because we are not compatible with the food, because we can't chew it properly, and all. Because if we take suppose spicy foods and any sour food, we can't take. Only liquid, like only few foods only we can take, because it hurts. It causes burning sensation. Sometimes ulcers may, spread also. Because of that, it may increase, the size may increase, ulcer size may increase due to the hot food or spicy food. So basically we feel like so much pain, so much inflammation, burning sensation, because if we take the food that we take, if it is sour or if it is spicy, it goes in our mouth and it touches the ulcer which are already in our mouth. So it is quite, it is not the favorable condition for us. It causes pain and burning sensation. Okay, now we are not able to, if the ulcer size is big, or one or two or three ulcers, then we are not able to talk also, because if we talk and it hurts, then also the ulcer, it hurts, the ulcer hurts. So these are the things which we feel when a patient have ulcer in the mouth. Now the treatment. What is the treatment of ulcer? I mean the cure. What is the things or tips which we can do treatment of the ulcer? We can cure it. So the first most thing is that we should clean our stomach. I mean we should make sure that we should fecate our fecate, and we should keep our stomach clean. We should eat some like food or some medicine, that constipation should not be there, that our stomach should be clean. That is the first most thing. And second is that if we are having the environment of our stomach like warm, or some hot, like we are taking some hot food too much, or hot drinks like hot water, or any kind of like tea and coffee too much, or some hard medicines which we are on prescription. So that all we should realize that what we are taking and why it is happening. First, the most important thing, we should realize that what is happening and why it's happening, that we should realize. Because if we'll control the things which we do, because of which ulcer happens, so we'll be able to control the things. And yeah, so we have to keep our stomach clean. Second is that if we are brushing, so we have to be very careful while brushing. We don't have to be in rush or do it fast, like because the brush is a hard object, and our oral cavity is very soft, thin line mucosa is there, and if we do in rush the brushing, it may hurt and it may cause ulcer. So that we have to keep in mind, that we have to do proper brushing. And second thing we can do is we can limit our medicines. We can consult our physician, our doctors, and we can adjust the medicine dose. We can discuss with them that it's happening, so things. So they may change the medicine, or they may think over it, that what is happening, why it's happening, the stomach is really getting affected or what. So that is the point. And yeah, the hot beverages too much if we are taking. See, ulcer is like we are taking too much hot beverages, or like that kind of things, like hot things. So that is like pimples are coming, same is like ulcer. Sometimes it happens because of that. Okay, so that is one of the reasons. So we can if we are taking that and it's happening, the ulcer is happening, so we can limit our hot food stuff, or hot beverages, hot water, coffee, tea, all that kind of stuff. Okay, now if the teeth is sharp, and if we are while biting, if we are many a times we bite buccal area, labial area, or our tongue area. So we have to be, we have to realize that, all I am telling, that we have to realize that why it's happening. Just you can't say that ulcer is there, I want treatment, I want this. That will be done, of course you should do, you should not be in pain in any condition. So like you have to realize that why it's happening. So you will only be able to subside the condition, or you have to tell the doctor also, no, why it's happening. He will ask, or she will ask. So, and that is important. Okay. So if the teeth are sharp, and if you many a times while chewing, you or talking, you bite, so you have to go to the dentist, and you have to make your sharp teeth, little little not blunt. You have to make the sharp teeth. You have to, the dentist will do it little, the spiky teeth or the sharp teeth, they will level it. I mean, they will do it in level. So that is the thing. Yeah, so these all are the conditions which we can avoid the ulcers. Now the treatment. Okay, now the treatment is as I said, what we do, like hurting through the brush, or sharp teeth, or taking hot beverages, not keeping clean stomach. I mean, if constipation is there. So this, in all these things we have to work. Okay. And the treatment is, of course, the medicine. See, we have to take the B complex medicine. Okay. And there is medicine, I mean that we have to take with water, that medicine, the tablets, capsule. Okay, B complex. And second is that we have to put some ointment, that is ulcer ointment, like dologel, mucogel. Okay, that comes in different forms, like paste form, I mean tube form, in tubes it comes. And it also comes like eye drop type, box, or we can say like box only. It comes in that. So we have to take from the pharmacist. Of course, we have to once visit to the dentist, and we have to take from the pharmacist the tube, the ulcer ointment, or the that liquid wala ointment from the pharmacist. So that we have to take, and we have to apply on the ulcer areas, especially before we eat. If we are eating the meal, just before that, I mean just 5 minutes before eating meal, we have to apply it for 10 to 15 minutes. And we have to rinse that our mouth, we have to rinse. So what will it will do, the ointment will anesthetize, and also in addition it will cure your ulcer part. Because when we eat the food, of course there will be discomfort in our mouth, because ulcer is there. So suppose some spices, some sour food are there which we eat, some little amount it will be there only. So what is the role of ointment, or the ulcer gel, or the ulcer ointment? If we apply before taking the food, it calms the effect of pain. I mean, the ulcer, in ulcer, if we apply the ointment, if we take after that we take the food, it will be good for us. We can have the food or meal properly. We can with the least amount of pain. And yeah, so that is the, and it cures also fast. So, and irritation will be also not there. If the ointment we apply before food, the spicy food will not hurt the ulcer. So yeah, irritation will be also not there. Now the B complex medicine is there, then ointment is there, keeping our stomach clean, doing proper brush, and if ulcer is there, we have to do mouth washes. Because we have to we have to do mouth washes. We don't have to depend on the brushing technique. We don't have to brush the teeth at least 4 to 5 days or 7 days till the ulcer is there. Because if we do the brushing, it may hurt more, it may bleed also, it may take more severe form, it may So we have to do mouthwash. It will also clean because it is antibacterial properties are there. So we have to do mouthwash. We have to just do take some amount of water. We have to mix the equal amount of mouthwash in that, and we have to gargle. We have to rinse our mouth. This is before brushing, or 2 to 3 times a day after meal we can do the mouthwash. No doing brush, or do a very proper brushing if you are a good expert at brushing while ulcer is there in your mouth. So yeah, so that is the third thing, like mouthwash we can do. It will also act as antibacterial and properties to our mouth, so it will be good, and it will be convenient also for us to clean the mouth as compared to doing brushing technique. Okay, so yeah, um I think everything I have told. Semi-liquid food we can take during ulcer. It will be more comfortable, and more fruits we can take. Like if not cold, I mean not winter season, so we can take like bananas. Also we can take. It will be like greasy type. It will do our stomach in well well favorable condition, if so these all are things. And ulcers are, it is sometimes recurrent, like happens then again it happens, or one some have 2 to 3 ulcers. So no need to get any worry or tension. Just follow the things which I have told. Just you by your own self you have to realize that why it's happening, and rest dentist will consult you, and he or she will provide you the best treatment. And thank you guys. Hope you all are well. Okay, thank you.